you know, you have to live, don't you? And you want to really enjoy what you're doing, and I think it's important, clearly, from your point of view, to not limit your life by a particular illness.
Yeah, and I just made the most of university life, and once I'd graduated, I moved to Spain for the year. And the only problem with not settling in one place for such a long time was that I didn't receive consistent healthcare. So I didn't have a GP that I had a good relationship with, and I'd often move around and see different specialists. So yeah, I didn't have consistent care under a consultant. And it wasn't really until probably my mid-20s when I decided to settle in Manchester, bought a house to renovate and really set some roots down, that I managed to establish a good relationship with a local diabetes centre. And this was a big turnaround for me, because I think in my early 20s, I'd sort of lived in the fear of the anxieties of maybe not controlling my condition to the best of my abilities. And I knew that this would subsequently have long-term complications for me. And I think lack of information at this point meant that I used to feel very anxious about not prioritising my health. And when I finally did start seeing this diabetes centre in Manchester, I was having regular blood tests, and I met a specialist nurse there who was amazing. And she was really able to relate to me as a young person and the needs and wants of a young person. So obviously I was working full time. I didn't always have the luxury to go to lots of appointments. And she would email me and keep in touch with me through channels of communication that made it a lot easier for me to respond to her quickly.
So you felt very much like she was much more personalised in her care. She kind of got you as well as she got your illness.
Yeah.
That had a positive impact in terms of what you were doing.
Yeah, really positive, because for once I felt like I was actually taking control and facing my fears. And once I'd actually come to terms with living with the condition, everything just seemed a bit more manageable, and I didn't feel as anxious about my long-term complications associated with the disease. So yeah, she made a real impact, because she took the time out to really understand my lifestyle and what I needed. And she was very personable and compassionate. And I think she was like that with all her patients. She really cared, and that compassion and empathy really came through.
And you also mentioned something which I liked, is that it was the first time you had consistent care. Yeah. So with hindsight, was that inconsistent, disjointed care? Is that something that kind of hindered what you were doing? And with hindsight, would you have preferred it to be more consistent all the way through? In
a perfect world, it would have been consistent from the beginning, but due to me moving around quite a lot and travelling and having years out, I just didn't really stay in one place for long enough to establish those relationships. So yeah, having settled in Manchester for a few years, it really made a difference. And she was able to refer me to a psychologist who dealt with helping people with long-term conditions, and she was really able to signpost me to resources that were out there that I hadn't been aware of before.
It's interesting, because I imagine during that period of life when you were moving around, you talk about inconsistency in the healthcare. I'm sure there were other services and other aspects of your life that were consistent, that actually used technology to overcome that moving around. For example, like banking, you know, you always have a consistent experience there. So there's probably a lot the industry can learn about leveraging technology to make it more consistent.
Yeah, I mean, I always find it bizarre that, you know, like you say with banking, you can go into any bank and access the information about your account, and for the past however many years you've been with that bank, they'll have all your data. And yet something that's as important as healthcare, and you go into a hospital and your notes can be dependent on what hospitals you've been to, not even consolidated into one centralised system. So you end up going to different hospitals, nobody knows what your history is, you end up repeating yourself quite a lot, and doctors don't even communicate between themselves, even in the same hospital. So that level of communication is really fragmented and really frustrating for a patient.
Are you frustrated when you're repeating yourself because you're having to say it again and again, or is it more a concern that is anyone actually listening to what I'm saying?
Well, yeah, it gets to the point when you've been pushed from pillar to post, seeing different specialists, and sometimes they don't like to take ownership of a patient, so they'll try and pass the responsibility onto another department, and then you sort of lose faith in the system because you think, well, who is actually looking out for me as a patient holistically? You know, they're just looking at their specialist areas of expertise. They're not really thinking about the patient as a person. So yeah, it can be disappointing.